Good morning, everybody. This is Dr. Vivek Lumba. I'm a pain management physician. Today, we are going to talk about palliative care management in cancer patients. As we all know, cancer is a debilitating disease, and as the disease progresses, so does the side effects. This includes not only the disease itself, it includes the immune suppression, it includes the side effects from various drugs, it includes the pain. The pain syndrome can occur from the disease itself, or it could result from the spread of the disease to various organs, and it could also result from some other secondary associated things like fractures resulting from osteoporosis, etc. For the palliative care in these patients, the pain syndrome is particularly very challenging one. It is challenging because not only it may be very difficult to treat, but once we start treating it, there may be side effects secondary to the use of various drugs and other associated modalities we use for pain management. So, a holistic approach is very essential in these patients. So, How do we exactly approach these patients? First of all, the primary aim is to recognize the problem. Pain itself can be a presenting feature in a lot of these patients. As the disease progresses, the studies have shown that pain is associated in terminally ill cancer patients in at least 75% of terminally ill cancer patients. So big chunk of big number of these patients do have pain. Now, once the problem is recognized, how do we assess the severity? The severities can be assessed by talking to the patient. You talk, you see what the patient is saying, when exactly is the pain, when, day, night, on movement, at rest, where exactly the location. Is it at the site of the tumor, or is it away from the tumor? Is it from a bed sore? What is the site? You talk to the patient's caregivers. They have a very, very valuable role in informing the pain physician where exactly the pain is and how the pain affects the daily activities of the patients. The lab results, they are very useful as well. Various imaging, the MRIs, the CT scans, they help us in assessing the pain management as well. So these are various things. The combination of all these things we use in assessing the pain in these patients. Now next comes about the identification of the goals. So once we know the pain is there, we identified the problem, we assessed how bad, how severe the problem is. Next is talking to the patient and the relatives and the loved ones. You define the goals of management. Okay, this is what we are going to do. How far we are going to go with this treatment. What are the side effects? What are the limitations? What are the benefits? And where we need to stop, where we need to escalate the treatment. Various do's and don'ts. They're very handy. We need to talk to the patients, write these goals down, which are for the benefit both for the patients and the relatives as well. So once we establish those goals of care, especially very true in terminally ill patients, where we can give much higher doses of medications, it's like opiates. But we need to identify the goals first. And once these goals are identified, they psychologically also the patients feel better. They know what can be achieved and what is the realistic expectations from the medications. So they do have a very significant role. Next comes is the pain management, actual pain management. How do we do that? There are various things. We use medications, lots of medications which we can use. The medications we use are like opiates, like the simple over-the-counter drugs like acetaminophen, the non-steroidal anti-inflammatory drugs. And then we use the adjuvants anti-seizure, pregabalin, etc. Other things which we can use are like acupuncture, psychotherapy, behavior therapy. We can also use some surgical techniques. There's this small lump that's troubling, the small tumor which can be excised. Great. we need a surgical excision there. In some cases, we can do a pain procedures like radiofrequency ablation, which may become very handy in these patients. Next would be the side effect management. The palliative care patients, they have already had too much in their life. The medications itself, they may be taking IV medications, so they may have side effects from those medications. They may have some other oral medications. They may have the pain medications itself that can cause various side effects. The common side effects in these patients are like nausea, vomiting, constipation, rashes, superadded infections from immunosuppression. Most of these can be managed conservatively at home. However, rarely we do need hospitalization, especially for serious infections or wound debridements, etc. The most serious infections could be like respiratory depression, which, if carefully monitored and regularly looked after, are not that common. Paradoxical hyperalgesia is a very well known side effect, especially in the terminally ill patients who are on high dose opiates. What is paradoxical hyperalgesia? So, as the disease progresses, the pain management physician will increase the dose of the opiates to manage the disease. As the dose of opiates increases, and especially if you're taking opiates for a long time at a relatively higher dose, that itself can cause you more pain. That's why it's called paradoxical hyperalgesia. So although you are giving more drug, so you think, oh well, I need a little higher dose of opiate. Yeah, you give that, and the patient is experiencing even more pain. You increase the drug further, the pain increases. So that's why it's called paradoxical hyperalgesia. So how do we treat that? What you call a break from the opiate cycle, a little window. We stop the opiate for some time, or we do opiate rotation. If you are taking, say, like one opiate, so you're taking morphine, then you switch over to another opiate, or you go to a fentanyl, or you go to tapentadol, some other opiate. So you do opiate rotation. This will help you to prevent side effects like hyperalgesia. Again, the pain physicians are very careful with these things. So a timely intervention and timely guidance from a pain physician is very essential in managing this aspect. So just to summarize, today we have gone over various aspects of palliative care management, which includes firstly the recognition of the problem, the assessment of the patient, the setting up of goals with the family and the patients, and then the treatment with various medications and other modalities. And lastly, we will talk briefly about various side effects of all the medication treatment that is going on in these patients. If you guys have any questions, please let me know. Else I'll see you in the next time. Thank you. Take care. Have a good day. Bye-bye.